Hello, everyone. My name is Elise Garvey from the King County Auditor's Office, and I, Brian Christ, and Ben Thompson are going to be presenting today on our COVID-19 pandemic response audit work. Before we dive into the content, we wanted to provide some additional information and acknowledgement. First, we wanted to acknowledge and thank all of the county employees and partners who contributed to this body of work, including all of the respondents to our workplace safety survey, senior executive, legislative, and judicial staff, and human resource managers and financial managers. We would also like to thank the researchers and staff at the Department of Environmental and Occupational Health Sciences at the University of Washington for their many hours working with us on the employee safety survey. For this audit, we focused on providing feedback in real time, so the information you will hear about today, particularly on employee safety and personal protective equipment, are findings that stem from evidence and observations we gathered over the last year. Additionally, the recommendations we have included are primarily looking forward in preparation for the next time we may be faced with the need to react quickly to continue providing services to the public safely and effectively under difficult circumstances. There were many elements to our pandemic response audit work. Today, we will briefly touch on some of our findings related to countywide employee safety, the procurement of personal protective equipment, or PPE, and quick summaries of the reviews and best practice papers we published on several topics. Each of the icons next to these sections will be used in the corner of the presentation slide to let you know where we are. The key takeaways of our presentation today are that for all of the areas we looked into, county leaders and staff took many actions to ensure county services continued under difficult circumstances. For employee safety and the procurement of PPE, there were some cases where there was a lack of checking to make sure safety practices were being implemented, and a lack of coordination created confusion and inefficiency and left gaps in safety protocols, particularly for county agencies not as used to procuring safety equipment or implementing safety practices. While there were many external forces that affected the county's ability to respond, including things like rapidly changing guidance as public health experts learn more about COVID-19, we also found that there were some causes that were within the county's control, such as ambiguity about roles and responsibilities related to employee safety and emergencies, and processes for procuring PPE. Future emergencies will look different, but the county will likely need to be able to implement emergency safety practices and procure needed equipment at some point again. And now is the time to take what we learned from pandemic operations about what worked and didn't work to prepare for those types of needs. This is why we've made recommendations to the executive to improve emergency planning by establishing a framework for employee safety that includes ways to check on the implementation of safety practices and has mechanisms for coordinating across agencies and branches on safety practices. We started with some high-level conclusions and recommendations, and now I will talk a bit more about some of the details behind them. First, we looked at the county's safety structure. In other words, who is involved in employee safety, what is their role, and what is their relationship to other actors in the system. You do not need to read through this whole graphic now. It is available in our report. We're going to focus on this orange box, the individual agency level. And we are focusing here because county documents indicate that this is the level with primary responsibility to ensure safety protocols are created and implemented. And this makes sense, as some agencies know their workspaces, and some agencies have additional safety requirements specific to their work, such as bus spaces, public health clinics, courts, etc. However, while safety is important for all, not all agencies or work units normally have the need for job-specific safety practices or have designated roles for that purpose. However, the COVID-19 pandemic created a need for safety protocols for all employees. Specifically, we are talking about the state and local mandates for mask wearing and recommended practices from the Occupational Safety and Health Administration and the Centers for Disease Control and Prevention, such as designating safety leads and identifying specific measures to limit the spread of COVID-19 in workspaces. These are the practices we focused on for this part of our audit work. One agency safety lead we interviewed noted that for some groups at the county, since there's not anyone specifically assigned to worker safety prior to the pandemic, people found themselves in a new role having to implement COVID-19 safety protocols, and additional proactive support would have been helpful. This may have come into play as we looked at county and agency level documentation on safety protocols. What you see on the far left are recommended safety practices, and the green and red boxes are our assessment of whether these practices were included and checked to make sure that they were in place. As you can see in the first column, all of these practices were included by at least some agencies. As you move to the right, where we assessed whether we saw evidence of someone at the agency or county level checking to make sure these practices were being implemented, we saw less evidence of that across the county. These proactive monitoring steps are important to make sure that people are implementing those practices and supporting employees who need help. This variation also showed up in our survey results. Our survey questions included things like whether employees observed safety practices being implemented, whether they had confidence in those safety measures, and whether they were facing challenges implementing safe practices. What you see on the screen is a representation of the collective responses from on-site employees. When we looked at how positively or negatively they responded to our survey questions, we found that there was variation at the agency level as to whether employees were confident in the safety measures being implemented. One area that came up that we included in our report were on-site settings where multiple agencies or branches needed to work together. For example, courtrooms, where respondents expressed some concern and frustration about what to do when they observed employees from other agencies not following safety protocols. This issue also came up in our interviews and in our review of documentation, where we saw a lack of mechanisms for cross-branch and cross-agency collaboration. So these are some of the key reasons we made recommendations for the executive to establish a safety framework and to enhance collaboration on employee safety across agencies and branches of government. And now I will turn it over to Brian.
Thank you, Elise. Good morning. For the record, I'm Brian Christ, King County Auditor's Office. As Elise mentioned, our next section focuses on PPE procurement during emergencies. We want to start by highlighting the role of the shortage. At the end of the day, there wasn't enough supply to meet the demand, and that was outside the control of the county. What we want to focus on are those areas within the county's control, so we may have the best outcome possible if we encounter another shortage in the future. Our recommendations in the report related to PPE and procurement are summarized here. To update emergency plans to include guidance on procurement during supply shortages. The goal here is to better coordinate across agencies, leverage the county's collective buying power, and best utilize the procurement expertise from professionals here at the county. The Washington State Department of Health prioritization guidelines for the allocation of PPE during shortages puts the emphasis on those at the highest risk of exposure through a tiered system. While agencies were directed to contact the Office of Emergency Management if they couldn't get PPE, OEM's primary focus was on coordinating supplies from the state as follows. Tier 1 has people working with COVID-19 cases that can't implement protective controls, such as hospitals or here at the county, our emergency medical services and public health outbreak investigators. Tier 2 has people working with COVID cases that can implement controls, such as designated crisis responders at DCHS, Sheriff's Office deputies, and staff at the isolation and quarantine facilities. I'll note that there is a narrow third tier, but it doesn't apply to most county operations. This leaves us with non-tiered agencies, which includes the vast majority of people at the county who are still reporting on site, like metro operators, FMD security, court clerks, and many more. While around 2/3 of employees were still reporting to the work on site, they did not qualify for PPE from the state. There were many barriers to agencies in all sectors. Metro found early on that 2 of their sections were quoted different prices for the same item from the same vendor. They learned from this and created a new system for managing PPE for their on-site personnel, which included dedicated staff to interpret public health guidance, source, and distribute supplies. Metro also played a large role in securing the early mask contracts to help supply all county agencies. Most smaller agencies did not have access to the same level of resources as Metro. Many people were pulled from their normal jobs to figure out procurement on their own, which resulted in having many individual silos, calling the same vendors to get the same information each day. Without clear guidance for those that didn't qualify for the state tiers, many agencies we interviewed reported frustration and confusion with the procurement process. Some agencies reached out to the professional buyers in procurement and payables at FBOT, who were constantly looking for and evaluating new vendors. Those that did were able to get the most current information on available supplies from reliable suppliers. However, not all agencies struggling with PPE knew about this resource or utilized them to the fullest extent. Our recommendations aim to provide guidance for agencies during shortages that better incorporates our procurement specialists in the process. Their expertise in county strategy, purchasing rules and policies, and up-to-date knowledge of vendors could help reduce frustration and confusion for everyone. The ability to aggregate demand and coordinate across agencies could help the county leverage its buying power to secure lower prices and avoid price gouging. This concludes the portion of our presentation around employee safety and procurement. We'll now touch on the following sections where we communicated issues as we found them in real time with the executive. I will cover customer service briefly and then hand it over to Ben for the remaining pieces of work. To summarize our work on customer service, as the county shuttered many of its doors in March of last year, we saw a risk that some members of the public could face barriers to accessing needed services. We compiled a collection of industry-leading practices and excellent customer service that aim to facilitate a great user experience regardless of how those services are delivered. You can find the technical paper that we published last May on our website, which includes both recommended activities for agencies as well as coordinating activities for the county. Now I'll pass this over to Ben, who will speak the remaining pieces of this work.
Thank you, Brian. This is Ben Thompson at the King County Auditor's Office. I'll be summarizing the remaining 4 areas we examined as part of our pandemic response effort. The first is how King County tracked and managed the significant federal support we received. Before talking about what we did, I would like to recognize the truly Herculean efforts of staff in PSB and FBOD, as well as the finance managers around the county who dealt with the lack of guidance from the federal government, particularly the Department of Treasury, around the eligibility of the uses for these funds, along with the unique challenges posed by the pandemic. Because of these complexities and the time sensitivity of many of these programs, we chose to look at the control environment in terms of how King County was set up to comply with federal, state, and county recommendations. We identified some instances where the process could be improved and communicated these issues in real time to the executive. They responded by taking corrective actions, including bringing on grant experts with the firm Witt O'Brien's to help manage the process. We then tested some programs to ensure that processes were being followed. Overall, while there are obviously lessons learned from this experience and ways in hindsight it could have been better, we think that King County is on the right track and did an admirable job in difficult circumstances. The next topic I'm going to discuss is furloughs. In August 2020, we conducted analysis looking at reducing county costs through furlough days. We modeled a baseline scenario based around the furloughs conducted in 2009 as a result of the Great Recession. We identified 2 additional scenarios which would achieve a 5% payroll savings by varying the numbers of furlough days by an employee's wage. We provided a letter to the executive documenting this analysis and detailing the scenarios. Luckily, King County was not forced to implement them. The third piece of work I'm going to talk about today was on the county's voluntary separation or early retirement program. We identified 8 steps the county could take to improve the program, like establishing consistent savings targets and providing clearer communication to staff on the purpose and eligibility rules of this program. We just started an audit to determine to what extent these steps have been integrated into the program, and you'll hear the results of that audit later this year. The final piece of work we conducted was a review of the planning for long-term remote work and the impact of remote work on compliance with public records requests. We provided an interim communication to the executive in late 2020, encouraging them to establish a process for making decisions and provided guidance about what data would be useful. We subsequently released an interim communication in April 2021 around this area. In these communications, we highlighted the importance of effective planning, as well as some decisions like reoccupying buildings or changing working conditions are costly to reverse. The executive brought on a consultant to assist in planning subsequent to our interim communication, and the process seems to be improving. However, this planning is complicated by a lack of accurate and up-to-date data on county-owned facilities and the lack of a comprehensive asset management system, which has been the subject of recommendations we've made in the past. Lastly, based upon council member interest, we also looked as to whether the transition to remote work had any effect on compliance with the public records requests and found no significant impact. In conclusion, King County was able to provide vital services to residents and the region, as well as stand up new programs and respond to evolving challenges. Our success was largely due to the hard work and determination of our King County employees across the organization. We need to learn from this experience. While we hopefully not face another pandemic in the near term, we need to document and continue those practices that worked and learn from things that didn't work. Implementing a robust lessons learned process, as well as putting in place the recommendations we've made over the last year, will put the county in a better position to respond to the next emergency. Thank you, and this concludes our presentation. Copies of the reports we discussed during this presentation are available on our website.